So, for me, what I think I would like to convey to everyone today, sure, I can talk now. For me, what I would like to convey to everyone today is that 1 in 3 persons that we encounter will likely have high blood sugar. That's an astounding statistic. Here, for us in the US, we have about 122 million people with high blood sugar. And you know what's interesting about that statistic? Most of it can be prevented because you have pre-diabetes and then you have diabetes. 34 million people have diabetes right now. So if most of the high blood sugars that we are encountering in our communities are from pre-diabetes, where your sugars are high and you can actually prevent it. There are simple things that you can do that can lower your risk of developing diabetes. And I'll tell you why it's important that you don't want to have diabetes. But before we get into that, let's talk about what pre-diabetes is. Essentially, it means that the sugars are high, but it doesn't reach the threshold when, for us as doctors or clinicians, that will say that you have diabetes. So your sugars are not normal, it's running slightly high, and if it continues to go higher, you will develop diabetes. There are things you can do to lower that risk. One, it starts with typical habits that we do. Here we are, having a good time, eating, and we can do some simple things that can lower the likelihood of us having high blood sugars. Generally, when you eat your plate, you should look at the plate. Half of that plate should be greens. Thank you for the engagement, love it. And the remaining half, part of that should be whatever protein that you are consuming, and the other quarter would be whatever starch or grains that you consume. The point I'm trying to make is that we should incorporate vegetables in our diet. It really helps. And one of the things that vegetables can do for you is that they will decrease the rate at which your blood sugars actually go up when your food gets digested in the stomach. And when your sugars go very high, it does a lot of damage to your organs. So that is why we try as much as we can when we manage our patients for diabetes or high blood sugars, we try to lower how high the blood sugars go. Another thing you can do is, you can do some simple exercise activity, which can involve just walking. I think for us as clinicians, sometimes when we say you should exercise, we tend to convey like you need to buy, equipment to build a gym, or you need to have a gym membership. Well, maybe you don't need to do that. You can actually just do some walking. That can help, because we do know that losing 5% of your body weight can significantly lower your risk of developing diabetes. That has been proven. So instead of waiting to develop diabetes and have us give you a medication, which we know is not effective, you making lifestyle changes can really lower that risk. So this is another example of where you can actually do something at home that can really lower your risk long term. So I'm just going to give you 2 points. Your plate and doing some sort of activity. Okay? Don't want to give you too much information, but those 2 things I think you can actually use on an everyday basis to lower your risk. So let's go a bit further and talk about what diabetes is. Unfortunately, with diabetes, your blood sugars are persistently high, and there are various ways that we can use that to diagnose you. But when you are told by your healthcare provider that you have diabetes, it means that your risk long term can really be catastrophic in terms of ultimately death can occur because of poorly controlled diabetes. We can start from head to toe. Your brain, you are at increased risk of having a stroke. Strokes can be very debilitating. Okay, so you can actually prevent that by lowering your risk of developing diabetes. And also, if you are diabetic, you can try to get your blood sugars better controlled. Likewise, blood pressure is important. So we're not going to ignore blood pressure too. We have blood pressure checks being done today. Usually we expect your top part of your blood pressure to be less than 140. The bottom part of the blood pressure should be less than 90. So if you are monitoring your blood pressures at home, these are the numbers that you should keep in mind. It's important for you to see a doctor if you are a diabetic, because the leading cause of blindness is diabetes. It's preventable. Why? You can get an eye exam that can take a look into the back of the eye to see if there are changes that can increase your risk of going blind. The reason for that is because diabetes causes bleeding in the back of the eye. And when there is bleeding in the back of the eye, the part that's important for you to see would actually get detached. So you just suddenly go blind. I've seen this in my clinical practice where patients will get up one day and they just cannot see. Very scary. And unfortunately, that's because the diabetes causes bleeding in the back of the eye, and when you get to that point, it's irreversible. So that is why it's so important to get an eye exam at a minimum once a year if you are a diabetic. Next is your heart. Diabetes causes the blood vessels in your heart to get smaller and smaller. So eventually over time you get decreased blood flow to the vital muscles of your heart that is important for the heart to beat. The heart needs oxygen and blood for it to function. So when the blood vessels get blocked, you get a heart attack. That's why you get chest pain, because the muscles are not getting the blood and oxygen required for them to work. So again, it's important for you to get checked by your primary care doctor or whoever you see to deliver your care, because you can get testing on your heart to determine if you are at risk, and we can do things that can prevent that from occurring. Next, we can talk about our kidneys. The leading cause of kidney failure is diabetes and blood pressure. When you see a doctor, tests are being done to check where your kidney function is. Also, there are tests we can do to check your urine to see if you have a lot of protein in your urine, because you shouldn't be losing protein in your urine. So that is why, again, it's important for you to see a doctor. Last but not least, your feet. They are important for you to move around and do things I probably don't even think about. But diabetes will increase your risk of losing your feet because it stops the blood flow to the feet. Also, it can make you lose sensation in the feet, and as a result, you are prone to damage your foot, get an infection there, not even realize it, and by the time things get to the point where you realize that, you probably have an infection in the bone that's very difficult to treat. That would increase your risk of you losing your limb. So, the important thing here is that it affects your independence, something we take for granted, because when we have complications from diabetes, you are dependent on someone else to help you perform the activities that you do every single day. So not only is it important for you to take care of yourself, but your loved ones. If you care about your loved ones, then you should take the responsibility of doing the things that are expected of you, which is going and seeing your doctor.